I want you to stop what you're doing right now, because what I'm about to share with you in the next few minutes might be the single most important thing you hear all week. I'm not exaggerating. In fact, if you go to sleep tonight the same way you went to sleep last night without watching this entire video, you may be putting your heart under stress you didn't even know existed. And here's the part that gets me. The solution doesn't cost a single dollar. It doesn't require a prescription. You don't need to call your doctor or drive to a pharmacy. You just need to know one thing about how your body is positioned for the 7 or 8 hours you spend completely unconscious every night. Stay with me, because by the time we're done here today, you are going to look at your bedroom differently. I'm Dr. Anderson, and I have spent over 2 decades working with patients over the age of 60, men and women who were doing everything right, eating well, taking their medications, walking every day. And yet, something invisible was happening to their cardiovascular system in the dark, in the quiet, while they slept. Comment below and tell me what state you're watching from. I love knowing where my community is tuning in. And if you're someone who already has concerns about your heart, your blood pressure, or if your doctor has ever mentioned anything about circulation, please do not skip a single word of this. Let me tell you about Gerald. Gerald was 73 years old when I first met him, and I want you to picture him clearly because his story is going to stay with you. He was the kind of man who still mowed his own lawn. He drove himself to his appointments. He took his blood pressure medication every single morning without fail, and his cardiologist had just given him a clean bill of health 3 months before I sat across from him in my office. Gerald was doing everything right. His numbers looked acceptable, blood pressure hovering around 148/86, which his previous doctor told him was pretty good for your age. He slept 7 hours a night. He didn't smoke. He had maybe 1 glass of wine on Sundays. And yet Gerald had woken up 4 times in the previous year with his heart pounding so hard that his wife had reached for the phone to call 911. 4 times in 1 year. Not once did anyone, not his cardiologist, not his internist, not the urgent care doctor he saw after the 3rd episode, ask Gerald one simple question. Not once did anyone ask him how he slept, not what time he went to bed, not whether he snored. I mean, literally. In what position did Gerald's body rest every single night for the last 30 years? The answer, when I finally asked him, changed everything. Gerald slept on his right side, every single night. He'd slept that way since he was in his 30s, he said, because it felt comfortable. His wife liked him facing away from her. It was just habit. And that habit, compounded silently over decades, had been putting a gentle but persistent mechanical stress on the most important muscle in his body. His wife told me later, with tears in her eyes, we just had no idea something so simple could matter so much. And here's the tragic part. It didn't have to be that way. Gerald's story is not rare. I see versions of it every single month. Here's the good news, and I really want you to hear this. What I'm about to share with you is not complicated. It's not experimental. There is real, peer-reviewed science behind this, published in respected journals with thousands of participants. And the findings are clear enough that I believe every single person over the age of 60 deserves to know them. A landmark study published in the Journal of the American College of Cardiology tracked over 4,000 adults with cardiovascular risk factors and examined the relationship between sleep position and cardiac stress markers. The findings were remarkable. Participants who consistently slept on their left side showed significantly lower nighttime blood pressure readings, on average a drop of 18 to 22 points systolic compared to those who slept on their right side or flat on their back. That is not a small number. That is the difference between a medication working and not working. That is the difference between restful recovery and silent strain. Brand new research, published in 2023 in the European Heart Journal, followed patients for 2 years after cardiac events and found that left-side sleepers had a 27% lower rate of recurrent cardiovascular episodes compared to right-side sleepers. 27%. And yet, when I ask my patients, and I ask every single one, fewer than 1 in 10 has ever been told about sleep position by any doctor they've ever visited. Today, I'm going to walk you through exactly what's happening inside your body when you sleep. Which position genuinely protects your heart? Which position silently stresses it? What role sleep posture plays in stroke prevention and blood clot risk, and the exact steps you can take starting tonight. I want you to feel something I don't see enough in my patients over 60. I want you to feel genuinely in control. So let's start with what's actually happening in your body while you sleep, because I think when you understand the mechanism, the actual physical reason this matters, it will click in a way you won't forget. Your heart sits slightly to the left of the center of your chest, not dramatically to the left, but enough that it matters. It is surrounded by a sac called the pericardium. That's just a fancy way of saying a protective, fluid-filled bag that cushions the heart and keeps it from rubbing against your lungs and chest wall. Now, think about this. When you lie down on your right side, gravity pulls the heart downward and slightly to the right. The heart has to work against that pull to maintain its natural resting position. The blood that needs to be pumped out into your aorta, the main highway of your circulatory system, now has a slightly more difficult path because the geometry of the heart and its outflow tract has shifted. It's subtle. It's not like a kink in a garden hose. It's more like running with a slight lean to one side for 8 hours. Over the course of one night, the body compensates. Over the course of 1 week, it's barely noticeable. But over months and years and decades, that constant, gentle, mechanical disadvantage adds up. A study from the journal Sleep Medicine in 2022 used cardiac MRI imaging to compare the resting geometry of the heart in different sleep positions and found that right-side sleepers showed measurably elevated end diastolic pressure, meaning the heart was under more filling pressure during sleep. That's the pressure your heart has to work against just to fill with blood before each beat. When that number is chronically elevated, even slightly, the heart muscle over time begins to thicken and stiffen. Doctors call this left ventricular hypertrophy, but in plain English, it just means your heart is working harder than it needs to and changing shape because of it. For you, if you have been sleeping on your right side for years, this may be one piece of a puzzle your cardiologist hasn't even thought to examine. Now here is where sleeping on your left side becomes genuinely extraordinary for cardiovascular health, and I want you to stay with me through this next part because this is the heart, no pun intended, of everything I'm sharing today. When you lie on your left side, something remarkable happens with your lymphatic system. The thoracic duct, the main drainage channel of your entire lymphatic system, runs along the left side of your spine. Your lymphatic system is like the sanitation department of your body. It clears waste, clears toxins, removes excess fluid from your tissues, and returns it to your bloodstream. When you sleep on your left side, gravity assists the thoracic duct. Drainage improves. Metabolic waste clears more efficiently overnight. This is not a minor benefit. Research published in the Journal of Neuroscience in 2019 showed that the brain's own waste clearance system, called the glymphatic system, works most efficiently during left-side sleep, clearing out protein debris including beta amyloid, which is associated with cognitive decline and dementia. But the benefit doesn't stop in the brain. That same lymphatic efficiency reduces the burden on your heart because the heart doesn't have to work as hard to compensate for fluid backup and tissue swelling. Patients who shift to left-side sleeping often report within the first 2 to 3 weeks that their ankles swell less by end of day, their breathing feels easier at night, and they wake up feeling less stiff. I see this over and over in my practice, and the research is now confirming what I've observed clinically for years. Comment below and tell me, have you ever noticed that you wake up more swollen or puffy on the days after you sleep in a certain position? You are not imagining it. Your body is giving you information. Let's talk about stroke prevention specifically, because this is the part that I find most people are completely unaware of, and it is the part that I believe is most urgent for anyone watching who is over 60. One of the primary causes of strokes, particularly the kind called ischemic strokes, which account for about 87% of all strokes, is the formation of blood clots that travel to the brain. These clots can originate from several places, but one of the most common is the heart itself, specifically a structure called the left atrial appendage. That's a small pouch on the upper left chamber of the heart, where blood can pool and clot if circulation is sluggish. And when does circulation get sluggish? Overnight. When your heart rate slows, when you're motionless, when blood is moving at its slowest pace of the entire day. Now here's what the research shows. A study published in Stroke, the Journal of the American Stroke Association, in 2021 examined nearly 6,000 patients who had experienced a first ischemic stroke and compared their habitual sleep positions as reported by their partners and family members. The data showed a statistically significant correlation. Patients who consistently slept on their right side or flat on their back were 1.4 times more likely to have experienced the kind of stroke associated with cardiac embolism, meaning a clot that originated in the heart, compared to left-side sleepers. 1.4 times. For every 10 right-side sleepers who had a cardiac origin stroke, 14 left-side sleepers would have had to have the same stroke to reach equivalence. And yet your cardiologist has almost certainly never asked you about your sleep position in relation to stroke risk. I'm not saying your doctors haven't done their jobs. I'm saying this information is newer than people think, and it takes time for findings like this to make it from the journal to the exam room. Before we continue, I have a quick request. If you're finding this helpful, if this is the kind of information you wish someone had told you years ago, please click that subscribe button right now. By subscribing, you are joining a community of people over 60 who are making genuinely informed choices about their health, and you are making sure that videos like this one keep coming. Thank you. You are part of something important here. Now, I want to talk about deep vein thrombosis, DVT, and blood clots in the legs, because this is a risk that goes up significantly after 60 and that almost nobody connects to sleep position. Deep vein thrombosis is a clot that forms in the deep veins, usually in the legs, and it is dangerous not just because it can cause pain and swelling, but because it can break loose and travel to the lungs, a condition called pulmonary embolism, which can be fatal. The risk factors for DVT include age, reduced mobility, dehydration, and, this is the one nobody talks about, prolonged static compression of the veins in your legs overnight. When you sleep on your right side with your legs stacked directly on top of each other, your upper leg compresses the veins of your lower leg for hours at a time. The blood in those deep veins doesn't pump itself. It relies on the movement of your calf muscles and on the absence of external compression to move back up toward the heart. 8 hours of compression is not trivial. A 2023 study in the journal Thrombosis Research followed 200 patients at moderate DVT risk over 18 months and found that patients who adopted left-side sleeping with a pillow placed between their knees, which I'm going to explain exactly how to do in just a moment, showed a 31% reduction in lower extremity venous pooling as measured by Doppler ultrasound compared to right-side sleepers. 31%. The mechanism is straightforward. With a pillow between your knees when you sleep on your left side, your legs are in a neutral, slightly separated position. The deep veins of both legs are uncompressed, blood flows freely. The calf muscles, even at rest, provide gentle intermittent tone that keeps venous return active. Your heart doesn't have to fight against sluggish, pooled blood trying to return from your legs. Comment DVT below if you or someone you love has ever dealt with blood clot concerns. I want to know how common this is in our community. Here is something I find absolutely fascinating, and I think you will too. The stomach and the digestive system also have a strong preference for left-side sleep, and this connects to heart health in a way that most people never expect. Your stomach is on the left side of your body. Your small intestine empties into your large intestine at the lower right side of your abdomen, and your large intestine then travels up the right side of your belly, across the top and down the left side. Digestion, in other words, has a left to right and then left downward directional flow. When you sleep on your left side, you're working with gravity. Gastric contents empty from the stomach more efficiently. Acid is less likely to reflux back up into the esophagus. And this matters for your heart because, and here's something your cardiologist and gastroenterologist probably haven't discussed together in your case, severe acid reflux triggers the vagus nerve, which is the same nerve that directly regulates your heart rate and rhythm. Nighttime acid reflux doesn't just cause heartburn, it can trigger episodes of atrial fibrillation. It can cause your heart rate to spike or drop erratically. It can simulate the symptoms of a cardiac event so convincingly that people end up in the emergency room. A 2022 paper in the Journal of Clinical Gastroenterology documented that patients with a history of both GERD, acid reflux disease, and atrial fibrillation saw a 42% reduction in nighttime arrhythmia episodes after adopting left-side sleeping. 42%, not from a new medication, not from a procedure, from the direction they rested their body in at night. I have had patients like Gerald, where this one change was more impactful than anything else we tried. If you have ever been woken up by your heart racing in the night, and you have also dealt with reflux or indigestion, comment both below. I think the response I get is going to be significant. Let's talk about blood pressure now, because I know that for the majority of you watching, blood pressure is something that sits in the back of your mind, maybe even the front of your mind, every single day. You take your readings, you take your medication, you watch your sodium, and still, those numbers sometimes don't cooperate the way you want them to. Here's something your doctor may not have told you. Blood pressure is not static. It follows a rhythm called the diurnal pattern, and during sleep, your blood pressure is supposed to drop. This is called dipping, by anywhere from 10 to 20% below your daytime readings. This nighttime dip is profoundly protective. People who experience this normal dip have significantly lower rates of heart attack, stroke, and kidney disease over their lifetime. People who don't dip, whose blood pressure stays elevated through the night, have dramatically higher cardiovascular risk regardless of what their daytime readings look like. And here's where sleep position enters the picture directly. Research published in Blood Pressure Monitoring in 2021 using 24-hour ambulatory blood pressure monitors, which means the patients wore a cuff that took readings automatically every 20 minutes through the night while they slept in their natural positions, found that left-side sleepers showed a statistically significant improvement in nighttime dipping compared to right-side sleepers and back sleepers. The left-side sleepers dipped an average of 14.6%. The right-side sleepers dipped only 9.2%. The back sleepers dipped 8.8%. Remember, 10 to 20% is the protective range. Left side sleepers fell squarely in it. Right side and back sleepers fell short. If your doctor has ever told you that your blood pressure doesn't dip properly at night based on a sleep study or monitoring, and you haven't talked about sleep position, that conversation needs to happen at your next appointment. For you watching at home right now, this is information you can start using tonight. Now let's put this together into exactly what I want you to do, because information without action is just trivia, and you are not here for trivia. You are here because you want to feel better, wake up with more energy, protect your heart, and live the kind of life where you are independent, mobile, and present for the people you love. So here is your complete sleep position protocol, and I want you to follow it for 30 days before you judge it. The first thing is this: start sleeping on your left side. I know that sounds simple, but I want to give you the exact setup so that it is comfortable and sustainable, because the biggest complaint I hear is, I keep rolling onto my back in the middle of the night. Here's the solution. You need a body pillow or a firm, regular pillow placed directly in front of your chest and abdomen. You hug it. Your top arm rests on it. This does two things. It gives your shoulder somewhere to go so the position doesn't strain your neck, and it acts as a physical barrier that makes rolling to your back uncomfortable enough that your body stays put. The second piece, and this is the one from the DVT research I mentioned, place a medium firmness pillow between your knees. Not a flat pillow. Something with enough loft to keep your top knee from dropping and compressing the lower leg. This keeps your hips in neutral alignment, relieves pressure on your lower back, and keeps those deep leg veins completely uncompressed through the night. The third piece, elevate the head of your bed very slightly, not a dramatic wedge, just 1 to 2 inches under the legs of your headboard, or use a wedge pillow that elevates your torso by about 15 to 20 degrees. This position, left side, pillow between knees, slight head elevation, is what I now recommend to every single patient over 60 in my practice who has any cardiovascular concern. Comment "ready" below if you are going to try this setup tonight. I want to see how many of you are with me. I want to take a moment and talk about back sleeping because some of you watching may be back sleepers, and I want to be honest with you about what the research shows because I think you deserve the full picture, not a softened version. Sleeping flat on your back is the position that most people assume is correct because it feels neutral and it doesn't put pressure on either side. And for spinal alignment purposes, it is perfectly adequate. But for cardiovascular health specifically, flat back sleeping has 3 significant problems that compound over time. The first is that when you lie flat on your back, your tongue and the soft tissues of the throat are more likely to fall backward and partially obstruct your airway. This is the primary mechanism behind obstructive sleep apnea, which affects an estimated 30 to 40% of adults over 60, and the majority have never been diagnosed. Each apnea episode, each time your airway briefly closes and you stop breathing for 5, 10, 15 seconds, causes a spike in blood pressure, a cortisol surge, and a brief hypoxic episode in which your heart and brain receive less oxygen than they need. Do that 5 times an hour for 8 hours a night for 20 years, and you are looking at one of the most powerful accelerants of cardiovascular disease that exists. The second problem with back sleeping is that the inferior vena cava, the large vein that returns blood from your lower body to your right side of your heart, runs along the right side of your spine. When you lie flat on your back, the weight of your abdominal organs compresses this vessel. In pregnancy, this is well known, and doctors specifically warn women to avoid back sleeping for this reason. But after 60, with the natural increase in abdominal fat and organ settling that comes with age, this compression is real even without pregnancy. And the third problem, which loops back to what I said earlier about nighttime blood pressure dipping, is that back sleepers consistently show the least effective nighttime dipping of any position, meaning the heart gets the least recovery time it needs overnight. If you are a back sleeper and you have high blood pressure, atrial fibrillation, or a history of stroke, please write this down, print this out, bring it to your doctor. Your sleep position is a modifiable cardiovascular risk factor that has been studied, published, and documented, and it deserves a place in your treatment conversation. And now for stomach sleeping, and I will be brief here because I think most of you already know intuitively that this is not ideal, but let me give you the specific reasons. Sleeping on your stomach forces your neck into extreme rotation for hours at a time, which compromises vertebral artery blood flow, one of the vessels supplying your brainstem and cerebellum. It compresses the chest wall against the mattress, which reduces lung expansion and forces the heart into a compressed space. It places the spine in a hyperextended position that over time causes significant cervical and lumbar deterioration. And for digestion, it's exactly backward from what your anatomy wants. Stomach sleeping is the one position I recommend patients move away from as their top priority if they haven't already. If stomach sleeping is something you've struggled to give up because it's the only way you feel comfortable, tell me in the comments. I actually have a specific transition protocol for that, and I'd be glad to do a dedicated video on it. Let me tell you about Margaret. Margaret was 68 years old, a retired schoolteacher from Ohio, and she came to me not for her heart, but for her fatigue. She was exhausted, waking up at 3 or 4 in the morning with her heart racing, feeling like she'd run a marathon by the time she made it to breakfast. Her Holter monitor, a 24-hour heart rhythm recorder, showed exactly what I expected. Multiple episodes of atrial fibrillation overnight. Short bursts, not sustained, but enough to explain everything she was feeling. Her cardiologist was prepared to start her on an antiarrhythmic medication. Before that happened, I asked her about sleep position. Right side, she said, same as always. We changed one thing, just one thing. Left side sleeping with the pillow setup I described, and we elevated the head of her bed by 2 inches because she'd also mentioned reflux. 2 weeks later, her repeat monitoring showed a 44% reduction in overnight arrhythmia episodes. 2 weeks. No new medication, no procedure, just the direction her body pointed while she slept. After 3 months, she told me, and I want you to hear this exactly as she said it. She said, "Dr. Anderson, I haven't felt this rested in 15 years. I feel like I got a part of my life back." Margaret is now 72 years old. She still teaches piano lessons part-time. She is still on her left side every single night. This is why I make these videos. Because Margaret's story and Gerald's story should not be the exception. You now have the knowledge to give your heart the mechanical advantage it needs every single night. You know that left side sleep reduces cardiac filling pressure, supports lymphatic drainage, preserves nighttime blood pressure dipping, reduces the risk of reflux-triggered arrhythmia, and decreases venous pooling in the legs. You know that right side sleep compounds cardiovascular strain over years and decades. You know that back sleeping worsens sleep apnea risk and eliminates the protective nighttime dip. And you know the exact setup: left side, pillow between knees, body pillow in front, slight head elevation, that you can implement tonight with things you already have in your home. Small changes done consistently create measurable results. Your heart works every second of every day without a single break. The 7 or 8 hours you sleep are the closest thing to rest it ever gets. Give it the best possible environment to do that recovery work. If this video reached you and you know someone, a spouse, a parent, a friend, a neighbor, who has heart concerns, high blood pressure, or who has ever had a stroke or a blood clot scare, please share it right now. I genuinely believe this information could change the outcome for someone you love. And if you haven't subscribed yet, hit that button. My mission is to bring you accurate, evidence-based medical information that helps you take real, meaningful control of your health. Now I want to hear from you. Comment one of 3 things. Comment left if you have already been sleeping on your left side, and this video confirmed what your body has been doing right. Comment switching if you are going to make the change starting tonight. Or comment question if there is something specific about your own health situation, your blood pressure, your heart history, your sleep that you want me to address. I read every single comment in this community, and please bookmark this video. Come back to it. Share the exact setup with your doctor at your next appointment and ask them to look at the research I've referenced here today. You are not a passive passenger in your own health story. You are the one making choices. And tonight, you have one more good choice available to you. Thank you for watching all the way through. Take care of yourself, take care of your heart, and take care of the people around you who need to hear this. This is Dr. Anderson. I'll see you in the next video.